A group of nurses decided to take their teamwork beyond just helping each other at work. They joined the Lighten Up East Texas Challenge last year, and they've been motivating each other to lose weight ever since then. CBS 19's Dana Huey finds out why the women decided to put their health first in Fit City tonight. Dana?
Their motivation? They're all moms, and the nurses decided they wanted to be around for the long haul for their children and to be a good example to their patients. They call themselves the Manhattan Mommas. The women all take care of others at the Manhattan Trinity Clinic for a living. And for the past year now, they're making time to do the same for themselves.
We knew that they needed to see that we as nurses and lab technicians, and there were several of us, needed to lose weight and set a good example. So, because how can we tell them to be healthy when we're not?
The motivation to drop pounds was even more personal for Donna Brooks.
In 2010, I was diagnosed with breast cancer. That was my first mammogram. And so last year they came out with statistics that reoccurrence is more common in patients who's had breast cancer if they were obese. And so that was my motivation. I mean, I want to live longer.
Donna started walking 30 minutes on her lunch hour. She and her Manhattan Mommas also met with a nutritionist.
It's more fresh food, vegetables, fruit.
The ladies started bringing their lunches, opting for healthier, less processed meals.
It's easier when not everybody's eating cookies and, candy and stuff like that. When other people are, eating fruit or vegetables, it's easier.
Jennifer Cowart is also a mom on a mission.
I have a 10-year-old autistic son, and I'm going to have to be around for him. And so I decided that I needed to, take better care of myself and make better decisions and eating.
Jennifer's accomplished that, dropping almost 50 pounds and reaching her goal weight.
And I had to buy different uniforms because, I went from like a size large to a size small in pants, and I've never been a small in pants like in my entire lifetime.
When you see someone losing weight and you're like, oh, well, how many pounds did you lose this week? Oh, how many pounds did you lose? So we kind of, we just help each other.
Dr. Brian Lowry,
he's our food patrol,
has watched the staff transform themselves, losing 235 pounds together.
So I'm proud of my staff losing so much weight. They're very dedicated to it. There's no magic pill. It's about working hard and watching what you eat.
Dr. Lowry's advice to his staff and patients: portion control, combined with a cardio program that works for you. The nurses say it's a lifestyle change that is worth it. Back to you.
Accountability is a huge asset. Dana, thank you very much. Now, Dr. Lowry says make a conscious effort to look at the labels of the food you're eating so you can see what you're putting into your body. He says you might be surprised by what you actually are putting into your body. And use those apps on your phone to track what you're eating and how much. He says that can help you stay on track.